I'm going to talk initially about my trip to China to try to introduce psychopharmacology to China in the late 70s. At that time, the United States had just fought a war against China in Vietnam, and in Korea, and the Vietnamese War was winding down. And Kissinger had held the secret meeting with Chairman Mao, and it resulted in the Chinese inviting a group of psychiatrists, leadership at NIMH and APA and the American Psychiatric Association invited me to join the group because they wanted a working scientist. When I got to China, I realized the Chinese were very interested to learn about psychopharmacology. During the Cultural Revolution, they had banned the use of drugs, and the psychiatrists had to treat the patients with herbal medication. Like the psychiatrists were more eager to learn about drugs than some of the psychoanalysts back in the US. When I was arrested, I received no training in psychopharmacology. At that time, I decided to write a textbook, and I thought nobody would read a textbook by a resident. So I got Don Klein, the person who discovered panic attack, to be an author with me, and we wrote the book. And it was the first scholarly textbook in psychiatry. The Chinese were very eager to learn, and I thought I'd invite a Chinese psychiatrist to study with me. I didn't have any public funds, so I paid for it out of my own pocket. But I sounded people out first about their interests. And Zhang Minyuan, one of the people I talked to, did want to return to China and spread the word. The other people were more interested in learning science. The NIMH invited them to the United States, but they defected after their fellowship was over to Formosa. Minyuan went back to China, and he and the Shanghai Psychiatric Institute invited me to give a series of lectures in China for a month. And you have to speak Chinese really to get along in China at any depth. So I took along a Chinese-American, Sidney Chang, who was an excellent psychiatrist and spoke fluent Mandarin. And this was very fortunate because when I arrived, it was a month of lectures, 10 days a week, or 6 days a week, 10 hours a day. Very glad I had Sidney Chang with me. And he interviewed the patients in Chinese and went over the DSM and the rating scales in Chinese. I gave the theoretical lectures. And Minyuan, who knew me well by that time, translated and actually expanded a little bit on what I said. If you tell a joke at that time, you can tell who speaks English and who doesn't, because you get two waves of laughter. The first to understand English and the second after the translation. If not, you may get an argument about how to translate what you said. But I think Minyuan's lectures were good. And I also, my book had just been translated into Chinese. I gave each student a copy. And Minyuan was invited to lecture all over China after that. He really introduced DSM and psychopharmacologic methods to China. I'm very proud of him. And he went on to become president of the Chinese Neuropsychiatric Society for a 5-year term. And that brings me to comment a little bit my students. I'm very proud of having a number of students. I've had 4 students of mine who've been chairs of psychiatry. I've had 2 who are members of the National Academy of Medicine. A number have had independent research careers that have been supported for years by grants. And they've had students. So I have scientific grandchildren. I'm very proud of my students and grandchildren. Another interesting thing that happened on that visit was at the time there was a parallel administrative structure in the hospital consisting of Chinese party members. If I met with the head of psychiatry, there'd be a Chinese party member present. Sidney Chang and I refer to that person as the head red. But at one of the dinners, the head red brought with him a high Communist Party official who also brought his own translator. At that time, it was very rare for Americans to visit China. And I thought this guy wanted to learn about the United States. So what I picked to tell him is was the role of voluntary organizations in the U.S. There are many of them, and they're very typical American. And the psychopharmacology was not well known in the 70s. I was often get calls from patients, mainly with questions about drugs, and I'd be invited to little meetings, 4 people, 8 people in local chapters of NAMI, or the Manic Depressive Association, or the Mental Health Association, to give talks. And sometimes they'd invite me to keep them company, a trip to Washington to lobby, to give it sort of gravitas. So I sort of got to know our senator from Illinois, Paul Simon, at the time. I'd sometimes sit with him in the airplane going back to Washington. But this stood me in good stead when, in August, all of a sudden, the House of Representatives in the state of Illinois cut the budget of our hospital 40%, and that would have really destroyed research and training. So I hired a lobbyist and went to the state capitol to lobby the Senate and got some of my friends in the advocacy organizations to call. And I got Paul Simon to call to put in a good word for me with the president of the Senate. And we got it turned around and the budget's reversed. Another example that would have been a good thing to tell him didn't happen until a couple of years later. But the governor decided to close our hospital in a week. And I had the good fortune that my social worker had a summer cottage next to one of the local newsmen who gave the evening news. And so the newsman gave a commentary about it, saying the governor cut research and training, but let's see what the governor spends his money on, and outlined a lot of foolish expenses. Next evening, another news person or rival station asked the President of the United States about it. NAMI and the Medic Depressive Association and so forth were very active and scheduled a march on the governor's office in Chicago. I hired a lobbyist again to do my bit. And I'd never met Governor Thompson. But all of a sudden, a couple of days later, he called me and said, "Hello, John, you know, my father's a doctor, and he's telling me you're doing great work. I've changed my mind and we've restored your budget." That would have been a great example of democracy at work. And I think the role of the voluntary organization is really very important, not only politically, but exchange of information among patients, psychological support of patients, funding of small starter grants, funding of research. It's innovative. Some people get the start of their career and carry on for years because they find something important and then they're able to get their own grants. It's like students' work carrying on in the mentor. And I want to end with something else that gives me pleasure. It's often, you often brag about something outside your field because it's different. And I've done something artistic. This really occurred because of contact with patients. I had a patient with Tourette's disease call me. Tourette's disease is a neurologic disease characterized by abnormal movement, sounds, and expletive speech. And I had not seen a case, but I know what it was, so I diagnosed the patient. At that time, Tourette's patients were often treated as psychotic, and some had long hospitalizations in psychoanalytic hospitals for intensive psychotherapy. But the word spread among patients, and at that time I diagnosed 70 patients, one of whom was in his 90s, never previously been diagnosed, and helped found the American chapter of the American Tourette's Society. And I realized that psychiatrists were unfamiliar with movement disorder. Some of these questions about side effects had to do with misrecognition of a movement disorder. And movement disorders are very visual. You have to see them to see what they are. Talking about them doesn't do any good. So I thought I'd make a movie. And I was able to get a movie made. And in this movie, we showed pictures of patients with movement disorders and had it discussed with me and with two prominent neurologists, experts in movement disorders. My role was to ask stupid questions so the neurologists could give a straightforward answer. And I thought it was a good movie. There is an organization which gives awards for movies, a national organization. They call it the Telly. It's sort of their equivalent of an academic award. And this movie did win a Telly one year in the category of educational movies. And I'm proud of that because it was something artistic. It was out of the scientific arena. I'd like to end by thanking you very much for this award. It means a lot to me. And also thanking you for allowing me to share with you some of the things that have given me pleasure in life. Thank you very much.